Take some deep breaths in and out for me.
In today's hospitals, the objective is to discharge people as early as possible, assuming that their families will take care of them. But what about those people who have no home or family to take care of them? Medical respite care is like home care for homeless people for those who are not sick enough to be in a hospital, but are too sick to be on the street or in shelter.
I have a spontaneous ruptured Achilles tendon, and that's why I'm in here this time. I sleep outside. I had a tent, but my legs swelled up from the injury. I don't know what would have happened to me if I didn't have here to come to. I think they would have put me in a regular hospital.
He's very tall.
This was a place where the homeless could rest in peace and not be judged. So I've been coming here for the last, off and on, for 10 years. And I feel very safe here, and like this is a home for us.
They're gonna clean up some of this area right here.
The most important is they kept me alive. It's not just my life. They have saved so many people that's walking around the city of Boston right now. If you got them together, there would be no room in this building. Nowhere in the building, and they'd still be standing on the street.
You can only stay with family and friends for so long, bounce from couch to couch, before you have to move on. And so, especially after a surgery like I had on my spinal cord.
Medical respite care provides acute and post-acute medical care to homeless people. Patients in respite care have a safe place where they can receive medical and nursing care, rest in a bed, get medications, and eat nutritious meals. They can also meet with case managers who can help them find housing or other supportive services that they might need.
Homeless because of physical abuse at home, and I had to leave, obviously, and that's how I became homeless. And I ended up in shelters because it was either shelter or I get beat up, and it was like, the shelter actually sounded better.
The years of being homeless have taken their toll on Joanne and have further compromised her health problems.
I have rheumatoid arthritis, which I believe came from being out in the cold weather all hours of the night. 3/4 of my liver is gone. I have hepatitis C. I had cancer of my thyroid, but that's okay. I have a glass eye from a glass in my face. I have stab wounds in my stomach. I have holes in my legs from an accident that got worse from being homeless, from not taking care of them properly.
So what you need to do, instead of taking it 3 times a day, really try to take it 5 times a day.
When Joanne was released from the hospital, she struggled to continue the follow-up care to her legs while staying in a homeless shelter and being out on the street every day.
But I know that sounds crazy and the hard part.
And so she came to medical respite.
And my legs were getting red, infected, and they went from small, this big, to this big. So I didn't have the ability to take care of them. And plus with my hands have rheumatoid arthritis the way they are, I couldn't take care of them either. So I was between a rock and a hard place. If this place wasn't here, I probably wouldn't have 2 legs right now, and arms, and a few other things.
Respite programs allow hospitals to safely discharge patients who are difficult to discharge because of the combination of them being homeless and having a chronic medical illness. And these are patients that the 2 options are dump them on the street and forget about them, or keep them in the hospital until somebody finds some solution where you get them a house or a family member shows up.
If I was in the street, I wouldn't make it. You know, trying to get to my radiation.
Respite becomes that third option.
I'm thrilled you're here and not outside, okay?
That third option is the best option because one, it maintains the dignity of that human being. You're not just dumping them out on the street, knowing that they ought to get better. But two, you're not keeping them in an acute care hospital, spending a lot of money, knowing that you ought to be doing something else with that money. Respite is that third option, and that's really a wonderful option to have.
Any chest pain?
And I couldn't have done all this on my own. Heavens no. I wouldn't have known where to start. That's why I was out there for so long.
It's also an opportunity for providers giving care to such a person to connect the patient to primary care, which they might not have had. And so their sort of haphazard, chaotic approach to being taken care of, which is to go to the emergency room when they have the flu or they have a bad blister on their toe, can be interrupted. They could be connected with primary care. And as a result of that, their frequent use of the emergency room is reduced, which is a much more effective way to be given care, and it also takes the burden off the hospitals.
I think that we in the emergency department make great use and really rely on that, on the homeless respite and the healthcare for the homeless group overall.
It helps to get your heart rate.
I think without the respite, our ability to make sure that these patients are cared for outside of this hospital is very limited. And our ability to offer care and to help them is very limited to what we can do here. And if the respite didn't exist, then they would leave here and often go out and would not continue to get any more care and would continue in the wrong direction or recurrence of the same problems. And we would tend to see these patients more frequently, often sicker than we do see them now.
Had any chest pain or trouble breathing?
No.
Okay, when you came in, you said something about some breathing problem. How is that now?
Now it's okay.
It's okay?
Yeah.
You're breathing normally?
Yeah.
Has he talked to you about that kind of stuff, like what's going to happen after your surgery?
And you've been taking all your medications
Yes, I have.
daily? Great.
Respite care provides an opportunity for people who are homeless to apply for housing, apply for jobs, get benefits that they might be entitled to, such as SSI, SSDI, or apply for other entitlements that would then help them break the cycle of homelessness.
How many years were you in?
I did 4 years.
So it's really supportive as a way to help people get out of the homeless situation that they might have been in for many years.
It's given me a safe place to lay my head. It's given me medical attention that I can proceed as I couldn't, and I believe I couldn't in a normal hospital for this long. And it's also given me social skills. It's helped me with housing. It's just given me inspiration.
Medicines, is just those 3?
I literally owe these people my life. They saved me. You know, and my heartfelt gratitude is I'm just overwhelmed what they're doing and accomplishing here.
Starting to believe in life again, I think. It's not that the world changed, it's just that I see it differently. I see the hope, that the possibility, the world live in a possibility, that anything's possible, that if you can have a place like a respite, that you don't have to die on the streets anymore. That imagine if you had a place like this everywhere. This would be like, could you imagine that?
Squeeze my fingers as hard as you can. Good.
They saved my life. They can save anybody's life. Because why? One question. They care. Simple as that.
Respite is a necessary part of the continuum of providing health care to homeless people and has a role in stabilizing the health of patients. The number of medical respite programs is growing across the country, but many more are needed.